Welcome to the deep dive. So you sent us some really interesting stuff, all focused on, well, how healthcare tries to get better, safer.
Yeah, quite a mix of sources.
Definitely. And our goal here in this deep dive is really to pull out the key insights from all that material you shared.
Kind of a briefing, yeah.
Mhm.
On the big frameworks, the main players in healthcare quality improvement.
Exactly, because you gave us a lot. Information on Joint Commission International JCI.
And the National Accreditation Board for Hospitals and Healthcare Providers, NEBH in India.
Right, and ISQA, the International Society for Quality in Healthcare.
And that very practical tool, the PDSA Cycle, Plan, Do, Study Act.
So the mission for this session really is to get a clear handle on what these are and why they matter in, the whole healthcare improvement picture.
Sounds good. Where should we start?
Okay, let's kick things off with Joint Commission International, JCI. That name seems to pop up a lot globally.
It absolutely does. For, over 20 years now, JCI has been seen as maybe the global leader in healthcare quality and, crucially, patient safety.
Their mission statement is pretty clear, isn't it?
Yeah, quite direct. To enable and affirm the highest standards of healthcare quality and patient safety for all.
And the scale they operate on to achieve that, it's pretty impressive.
It really is. We're talking about work in, over 70 countries?
Yeah, across Asia, Europe, the Middle East, Africa, Latin America. It's genuinely global.
And they've accredited or certified over 1,000 programs. That's a huge footprint.
It shows how widely their standards are recognized, I suppose.
Exactly. And what's really telling is the impact this accreditation has. Your sources had some interesting quotes from hospital leaders.
Right, the testimonials. It's clearly not just about getting a badge.
No, not at all. Leaders from Hong Kong Adventist hospitals, they talked about real benefits, better teamwork, improved coordination between departments, things that really matter for quality care.
Yeah, fundamental stuff. The president there even said the process itself helped build the team.
Which suggests it's a pretty rigorous process, not just ticking boxes.
And then there was the senior quality officer at Burjeel Farha Hospital. They mentioned community confidence.
Makes sense, right. Patients want that assurance, that international standard.
Definitely. They also pointed to better risk management and just building a stronger culture around patient safety.
Those are critical outcomes. It's about becoming a learning organization, always looking to improve, minimize risks.
The chief administrative officer at Emirates Specialty Hospital kind of echoed that, said the JCI Gold Seal builds patient trust, signifies safe, world-class care.
That Gold Seal seems quite prestigious.
Apparently so. And the quality manager at Corniche Hospital, they mentioned getting it for the 6th time.
Wow. That shows real long-term commitment. They clearly value JCI as a driver for improvement.
So what does JCI actually offer to help hospitals and clinics reach these standards? It can't just be the final accreditation visit.
No, you're right. It's a whole suite of things. Obviously, the accreditation programs are central for hospitals, labs, ambulatory care.
But also specific areas, right, like clinical care programs?
Exactly. And they're moving into newer areas, too, which is interesting. Healthcare sustainability certification, telehealth certification.
Adapting to how healthcare is changing. Sustainability is a big one now.
It is. And beyond those main programs, they have standards based on their international patient safety goals.
Those are the big global risks, yeah. Things like patient identification, communication.
Precisely. They offer advisory services to help organizations prepare, tools, and training for high reliability, making safety consistent.
Online solutions, too, publications. It's a whole support system.
Right. Aimed at helping organizations measure where they are, assess it against international standards, and then, improve.
That measurement piece seems key, not just trying to improve, but actually tracking it against benchmarks.
Yes, demonstrating progress against rigorous criteria. And for people deep in this field, JCI's got that big conference coming up, Unify 2025 in Washington, D.C.
Ah, yes. Sounds like a key event for sharing what works, what the challenges are.
Definitely. These conferences are vital for spreading good ideas.
We also saw some recent news snippets from JCI. They're clearly not standing still.
No, definitely dynamic.
Yeah.
That healthcare sustainability certification we mentioned that's new with the Geneva Sustainability Center.
And an 8th edition of their hospital standards. They keep updating things.
They have to. Plus a new laboratory accreditation program combining ISO 15189, that's the big international lab standard, combining it with JCI's own requirements.
Interesting. So integrating existing global standards.
Seems like it. And opening a new office in Riyadh, Saudi Arabia. expanding their direct presence.
Okay, so overall, JCI sounds like a major global force setting standards, but also actively evolving and supporting organizations worldwide.
That's a good summary.
Yeah.
Now, should we shift focus a bit
Mhm.
to the National Accreditation Board for Hospitals and Healthcare Providers, NABH?
Yes, let's do that. This gives us the Indian perspective, which is really important context from your sources.
Exactly. So NABH, it's a constituent board, basically part of the Quality Council of India.
Right. And its job is specifically to run accreditation programs for healthcare organizations in India.
Correct. The idea is to cater to the needs of Indian consumers, set benchmarks for India's health industry, but it operates with functional autonomy.
So while JCI is global, NABH is tailored specifically for India.
That's the key difference. And interestingly, your sources highlighted a link between NABH and that PDSA cycle we mentioned earlier.
Yeah. Plan, Do, Study, Act.
It seems many hospitals in India use PDSA quite actively, perhaps as part of meeting NABH quality indicators or for their clinical audits.
So taking that practical, internationally recognized improvement method and applying it within their national accreditation framework.
Exactly. Shows how these ideas get adapted locally.
Okay, so we've got the global giant JCI, the national player NABH. What about the International Society for Quality in Healthcare? ISQA. That sounds like another big international name.
It is, but maybe in a slightly different way. ISQAS is really about building a global network.
A network. How so?
It brings together a really diverse group of people, all interested in improving healthcare quality and safety. We're talking doctors, nurses, administrators, policymakers.
Patients, too, you said, and carers.
Yes. Patients and carers are explicitly included, and they come from over 70 countries, 6 continents. So it's a huge mix of perspectives.
And their mission? Similar to JCI's.
Broadly, yes, to actively improve healthcare safety and quality for all. But their focus seems very much on connecting people, sharing knowledge, fostering collaboration, like a hub.
Okay, so what do people or organizations actually get by joining this network? What are the benefits of ISQA membership?
Well, access to that global community is a big one. Sharing ideas, problems, solutions. They also offer exclusive content on their website, discounts on their conferences.
Which can be a pretty big saving, I imagine.
Definitely. Plus access to their journal, the International Journal for Quality in Healthcare, IJQHC. That's a well-respected publication.
Right.
And opportunities to connect with experts, and importantly, a platform for members to share their own work and voice.
So it's about creating that community feel, that shared learning environment globally. And they have different ways to join, different tiers.
They do, which makes it accessible. There's an iSquad guest option, which is free, limited access, but lets you see what they offer.
Okay.
Then iSquad Friend, also free, but specifically aimed at people in lower-income countries. It gives broader access, even to past conference recordings, and a specialist certificate.
Oh, that's really good. Promotes inclusivity.
Absolutely. A great way to support quality efforts everywhere. Then you have the paid levels. iSquad Member, which gives full access, the journal, discounts.
Standard membership.
Right. Then Member plus Fellowship for individuals wanting deeper engagement. And finally, institutional membership for whole organizations. That gives multiple logins, other perks, like maybe getting an iSquad expert speaker.
A whole range then, depending on your needs. And like JCI, iSquad has a big conference coming up, Sao Paulo 2025.
So these international meetings are clearly central to how this field shares knowledge and moves forward.
And iSquad does other things too, beyond membership and conferences.
They have something called the IEEA, the iSquad External Evaluation Association. It actually accredits other accrediting bodies.
Wow, like quality control for the quality controllers?
Kind of. An extra layer of assurance. And they run educational programs too, the fellowship program, various courses, really focused on building expertise.
Okay, so we've got JCI setting global standards, NABH focusing nationally in India, and ISWA building this global network for learning and collaboration. That covers the organizations well.
Yeah, I think so.
So let's pivot now to that tool you mentioned is used in India with NABH, but is really universal, the PDSA cycle. This sounds like where the rubber meets the road, actually doing the improvement.
Absolutely. PDSA, Plan, Do, Study, Act. It's such a fundamental practical method. It's basically a 4-step loop for continuous improvement. Think of it like the scientific method, but adapted for action for learning by doing.
Okay, let's break it down. Step 1, plan. What happens there?
Right. Plan. First, you need to be really clear. What problem are you trying to solve? Or what opportunity for improvement are you targeting?
Define the issue.
Exactly. Then you set some goals. What does success look like? Make them measurable, if possible. And then you develop the actual plan for a test of change.
A test, not the full solution.
Usually not initially. The idea is to test a change on a small scale. So the plan outlines what specific change will we test, how will we do it, who's involved, what data will we collect to see if it worked. You brainstorm potential solutions here too.
Got it. Plan the test, define success, figure out data collection. What about do?
Do is simple.
Yeah.
You carry out the test according to your plan. But the key here is small scale. Maybe one ward, one clinic, one process for a limited time.
Like a pilot.
Precisely.
Yeah.
And while you're doing it, document everything, what actually happened. Any surprises, problems, observations.
Okay, test it small, write it down. Then comes study.
Right. Study. This is where you look at the data you collected during the do phase. You analyze it. Did the change have the effect you predicted in your plan?
Did we meet the goal?
Did we meet the goals? What worked well? What didn't? What did we learn? It's the crucial reflection and analysis step.
And based on that study, you move to act.
Exactly, act. What do you do next based on what you learned? If the test was successful, you might decide to adopt the change. Maybe standardize it, roll it out more widely.
Implement it properly.
Or the study might show it needs tweaking. So you adapt the change, refine the plan, maybe adjust the process, and then you go back to the plan stage for another cycle.
Run the test again with the changes?
Yep. Or maybe the test showed the idea just didn't work or had negative consequences. In that case, you might abandon the change and go back to plan to think of a different approach. The key is that it's a cycle. You keep going round.
So it's really about iterating, testing, learning, adjusting, testing again, not expecting perfection first time.
That's the core principle. Test small, learn from the experience, and systematically improve. It reduces the risk of making big, potentially disruptive changes that don't work.
Your sources had that example of the surgical ward and pain medication. Can you walk through that using PDSA?
Sure. So, plan. The team identifies delays in giving post-op pain meds. They hypothesize maybe the medication chart is unclear. Their plan is to test a redesigned chart with clearer timing fields and do a quick training for nurses on one specific unit. They decide to track the percentage of meds given within 30 minutes of the scheduled time.
Okay, clear plan.
They implement the new chart and training on that single unit for, say, 1 week. They carefully record administration times.
Small scale test.
Study. After the week, they analyze the data. They compare the percentage of on-time meds before and after the change on that unit. Let's say they see a significant improvement and nurses give positive feedback about the new chart's clarity.
So the test worked.
Looks like it. So act. Based on the positive results, they decide to adopt the new chart design and training, perhaps with minor tweaks based on the pilot feedback, and roll it out across all surgical wards. Then maybe they start a new PDSA cycle on a different aspect of pain management.
That makes it very concrete, and it highlights those key ideas. Start small, use data, document, and iterate. Run multiple cycles.
Exactly. And it's generally seen as non-threatening. It's about testing ideas, not blaming people if a test doesn't work out. Safe experimentation.
And like we said, this PDSA cycle seems quite embedded in India, linked to NABH and clinical audits, but it's obviously applicable anywhere.
Oh, completely. Its strength is its versatility. Reducing errors, improving discharge planning, cutting wait times. You can apply PDSA to almost any process you want to improve.
You even had those fictional insights from Mr. Raghav Sinha, the nursing superintendent. That added a nice practical touch.
Yeah, his experience gave some useful color. He talked about his first PDSA project on hand hygiene, using glow-in-the-dark stuff.
Yeah, to show missed spots. Yeah. Memorable.
He also mentioned a common challenge teams, sometimes making the initial plan too complicated, trying to boil the ocean in the first cycle.
Keep it simple, especially at first. Makes sense. And how did his teams track success?
A mix of things. Simple logs, observations, feedback forms, before and after data. But he stressed the importance of the team reflecting together during the study phase.
That discussion part. Why did we see these results?
Exactly. More than just the numbers. Understanding the why. His favorite project example was about reducing patient falls on a geriatric ward.
Using night lights and bed alarms.
Yeah, testing those interventions using PDSA cycles. A really impactful application.
And his final takeaways were quite neat. Start small, think big.
Document and reflect.
Cycle, don't sprint.
Yeah, captures the PDSA philosophy well. Manageable steps, keep the goal in mind, learn as you go, and realize it's an ongoing process.
Fostering that culture of continuous improvement you mentioned earlier.
Precisely. Empowering teams to test ideas safely.
Okay, so wrapping up this deep dive, we've really covered some key ground. These big organizations, JCI globally, NABH in India, the iSquad network,
Right. Setting standards, focusing nationally, building connections.
and then this incredibly practical tool, the PDSA cycle, for making change happen on the ground.
And underlying all of it, as we said at the start, is that drive, that commitment to making healthcare better and safer for everyone. That's the common thread.
Absolutely. Whether it's through formal accreditation or these iterative improvement cycles, the goal is the same, enhancing quality and safety.
It's a constant effort.
It makes you think. These principles of continuous improvement, the PDSA cycle especially, they aren't just for hospitals, are they?
That's a great point. It's a way of thinking, really, a structured way to learn and get better.
Yeah. You could apply it anywhere you want, make progress. Maybe something for our listeners to ponder. What's one small thing in their work or life they could try to improve using a little plan, do, study, act?
Interesting thought to end on. A surprisingly powerful approach, that little cycle.